SPIFFY, the Strategic Planning Initiative for Families and Youth, is a Hampshire County-wide coalition that has been in existence for over 20 years. We connect with all sectors and help local communities reduce risk factors and increase protective factors to reduce youth substance use and help build healthy communities for all youth.
Prevention efforts focusing on the environment aim to build communities that protect young people from early substance use. Coalitions are made up of people and groups from across many segments of the community to identify the strengths and needs of young people and families. Together, we collect information and data, and we look at community culture and norms. We plan and implement strategies that are aimed to improve the outcomes for youth.
So SPIFFY pivoted during COVID-19 by responding to the needs of our partners for connection, coordination, and resources. So at the beginning of the pandemic, SPIFFY hosted cross-sector community networking meetings. We discovered that many of our usual partners, including schools, healthcare, municipal leaders, law enforcement, and higher education, were grateful to SPIFFY for hosting networking meetings early on in the pandemic, but were actually less available as COVID cases in our region began to soar. So many of our health and first responders partners reported working 90 and over hours a week. And at the same time, we also discovered that young people, parents, coalition coordinators, and social service agencies were eager for connection and support.
I think one of the things that was apparent as soon as COVID began was that all of our partners in any of our meetings, no matter what the topic was, had youth on their mind.
When trauma happens in childhood, it can carry over into adulthood and into all kinds of health consequences and poor health outcomes. And we are seeing now with COVID especially a rise in mental health issues as well, and people really struggling and young people struggling.
So often we see that kids that are suffering with any kind of mental well-being issues turn to substances as a means of coping. So the more that we can address mental health issues and get kids more grounded and a good direction, then I think that does wonders for prevention of substance use.
The mental health effects of COVID will probably continue over the summer and potentially even into the new school year. So we want to be able to support that. And we know that underlying mental health concerns can often contribute to substance use. So it seems like it fits exactly with our mission.
At the onset of COVID, when we were all sent home, I made sure that parents were notified of what the symptoms of vaping withdrawal might look like. We knew that with youth now at home, in close quarters with their families, all likelihood, their opportunities to vape would decrease, and we wanted families to know what might be going on with their health. The second thing, which was a statewide policy, is that as of June 1st, menthol, mint, and wintergreen tobacco products are no longer allowed to be sold in retail outlets throughout Massachusetts. As you probably know, the federal government has just recently taken on this same policy.
Due to the pandemic, we were able to look at retail sales a little bit differently. A lot of restaurants and bars were closed, so we looked at how we could address youth access to alcohol. We did outreach with education and trained the servers, followed that up with a compliance check. And then about a month later, during the holiday season, we sent out gift bags to all of the retailers in South Hadley. They included custom-made masks that said "We ID, We Card," and our coalition logo and website, as well as offering signage for the store and window clings and some holiday candy as well.
So another thing we did in South Hadley is we had 2 pizza shops that agreed to put stickers with our coalition logo on with a reminder not to serve anybody under 21. And we did it right before the Super Bowl, and we purchased 1,000, and I believe they gave those out within 2 weeks.
What we're seeing from this pandemic, there's so many terrible things about it. And then there's so many amazing opportunities that have arisen from it. I think that's like the way of the pandemic. People are like, how are you? I'm like, I'm awesome. And I'm completely terrible in the same moment. So it's like, it's totally terrible. Wow, look at these new opportunities.
Everybody got used to using this Zoom. And so we took advantage. Let's capitalize on using Zoom and this strange remote way we're connecting. And we didn't realize that we that opportunity for young people to connect to other young people in Western Mass that they would never otherwise meet was opened up.
Every communities that we go into, to be able to show how to maintain and support young people through this mentoring process. We have high school students being mentored by college students, and then we have high school and college students mentoring elementary school students using art, music, dance, homework help to create connection in a way that motivates and provide a space for young people to know that they're cared for.
I see a really different dynamic when you have one or two students from one school with a bunch of students from other schools. As we know with social norms, students tend to have like almost a lower perspective of what their other peers think about health. And I think we break through some of that so people feel comfortable talking about what they really think and what they really know.
Public health is social justice health. You know, we've got to look at health disparities and how do we look to change them? How do we create greater access for all in our healthcare system? And how do we that means we've got to look for the weak spots and we've got to do better.
We have a group of women of color in this office that meet every month, and we talk about what we can do as women of color in law enforcement and support that work that we do here, maybe implement additional strategies and ways that we can improve.
Racial justice is a topic that youth have been really interested in engaging with this year. They ran 2 Black Lives Matter workshops to engage youth in that topic and educate them about the movement. And they also raised almost $450 for Black Lives Matter Boston and the Transgender Emergency Fund by making art around those topics and raffling it off. And also during a forum with their legislators, they spoke directly to their legislators about racial justice issues and how it's affecting youth, as well as what they'd like to see their legislators do on those topics.
Together, we created a United Against Racism plan, which is really comprehensive, and Cooley Dickinson created our own version of that. And we've looked at all sorts of clinical policies and made changes. We've looked at our recruitment, hiring, and retention policies and practices and made changes so that we have a better chance at recruiting a diverse staff.
We do this Law Day event in connection with the American Bar Association. The topic this year was rule of law. So we reached out to some student groups and said, what would be interesting to you about the rule of law? And what we ended up doing was the rule of law and the role of protest in the United States. And so we had a constitutional scholar from Western New England University address it. We had students from PVPA, Pioneer Valley Performing Arts Charter Public School, do skits about it. But basically, it was really something that came out of the widespread protests of the past year.
Just really shaped the way that I think about privilege and power in our community.
I think the really exciting way the HIE and our partnerships with SPIFFY and many of the other youth prevention coalitions can and will grow is by having better, more timely data analysis. So taking the data that we do have, taking the connections that can be made through that data and correlations, and providing a comprehensive analysis that can be tailored to each community's needs, their interventions, their prevention strategies, and as well their goals.
Regularly updated aggregate reports will be available to data sharing partners within the Health Information Exchange, and additional tailored reports can be requested.
Moving forward, SPIFFY and Hampshire Hope will be working together to develop strong youth leadership in the region around public health issues. And when we think about data collection, data analysis, and sharing data, sharing the stories behind the data and sharing meaning behind the data, we hope to build a network of youth and young adults who can take this on, who can be part of collecting data, who can be part of helping us understand the data, and will take a lead role in sharing the data in the community. As well as the youth will play a strong role in helping us think about, well, what do we do with this data, and what are the interventions we want to engage our community in?
We are currently bringing together existing and new youth groups to network and talk about how to better support youth leadership throughout the county. One way we're supporting young people is by hosting community conversations with the goal of building and strengthening intergenerational relationships and centering youth voice into local policymaking and decision-making. We are really working hard within our coalition to better model power sharing as well as racial and social justice work, which at its heart starts with building relationships in a really intentional way.
It would have been so easy to be like, oh, well, isn't this the universe telling us that we're done with our mission, right? That's my biggest pride, to be honest, is that it's actually found a way to continue on after this, so, and in a new life.
The work that Hope is doing, that SPIFFY is doing, and that others in our region are doing is just tremendous. It's going to make a huge change. It already has made change, helping our young people to live healthier lives, helping our community to be safer, a better place to raise kids, a better place to grow up. And I'm just excited by our future as long as we all keep working at it together.